Hello, how's everyone doing? I see some people are joining us. It's 5:55, so we're a little bit early, so I'm going to give it some time for the people that are already here. Thank you for joining this webinar. You guys can send me questions via the chat box, and I will get to them by the end of the webinar, and I'll make sure I answer all the questions. So we'll just wait now and wait until more people join us. Hello again. I see more people are joining the webinar. It's still a little bit early before we start, but I was just I'm going to put it out there. So how many people are joining us from Las Vegas? You guys can use the chat line. It's all private, so no one else can see it, and you can also use the chat line for any questions you might have during the presentation, and I will get to them by the end of the presentation. Okay, so we got a couple of people from Las Vegas. Well, thank you for joining us. We'll give it a few more minutes and just try to start a few minutes after 6 p.m. So that gives enough time for some stagglers to come on in and join us. Actually, can everyone, at least the ones that have joined us, can you guys hear me okay? And can you guys see my screen with the title of the talk? If someone can just let me know in the chat, I'd appreciate it. Thank you. So it's almost 6 o'clock. Let's give it a few more minutes. And we'll get started. I don't know if you guys were present during our last webinar. We had some technical difficulties, and the PowerPoint was not visible to you guys. So I had to end up emailing it to a bunch of people that were interested in it. So I think we've worked through the issues, and obviously we have the PowerPoint now. All right, so we're having a few more people join us. So just are most people from Las Vegas, or we have a lot of people from other parts joining us? Okay. Looks like mostly it's Las Vegas people. All right, we got some Chicago people. Actually, I did my residency in anesthesiology in Chicago, so It's a great city. Okay, so we'll give it like 2 more minutes. I'll just give you guys a little bit of a background about myself. My name is Pouya Mohajer. I'm a anesthesiologist and pain physician here in Las Vegas. I've been in Las Vegas since 2004. I have a pain clinic, and I've been intimately involved with the treatment of pain and looking for alternative modalities to help patients with pain and not just go down the opiate path. I've been always strict with the opiates, and I've always felt like cannabis can, in the right people, obviously be helpful for a lot of patients. So the talk today is going to be titled Cannabis and the Brain. I wanted to thank Sanctuary Dispensaries for sponsoring this and putting the word out on this webinar. The topic was actually picked by a poll that they sent out, and a lot of people had some questions about how cannabis affects the brain, and I thought that was a great topic to start with. We've done a few other webinars before, and I try not to go over the same topics, obviously, if we've already had it before, but I thought this was a very good topic to address, especially with a lot of information that's coming out in the news, and it's hard to tell what's real and what's not real. So I think it's important to have some scientific basis to things. So we're going to have some people coming in and leaving. So we'll just get started because I know everyone's time is valuable. So you guys, I'm going to be using the PowerPoint so we can follow along. Now, if anyone has any questions, please just put it in the chat. It's private, and I will get to all the questions by the end of the webinar, and I'll try to answer it as we go if it's possible. If not, I might just focus on the slides, and then after that, just answer all the questions. But rest assured, we will get to all of them because they'll be in the chat box, and I definitely will be answering them. So, as a disclosure, I am the Chief Medical Officer of Nuveda, which is a medical cannabis company here in Las Vegas. I'm also a consultant for a neuromodulation company. A little bit of overview. We're going to cover a little bit about the plant, the nomenclature, what's going on with cannabis research, the role of FDA, how the cannabis affects you to the body, and how the body affects the plant itself. Then we're going to focus most of the lecture on the specific effects on the brain, and two topics that are very important as well is the adolescent brain and also cannabis use in pregnancy. As most people know, there's two main types of cannabis, the sativa and the indica, and most of the products that you actually see in the dispensaries are the hybrid, which is a combination of the sativa and indica in different ratios. Cannabis research is obviously very regulated. It's a Schedule 1 substance under the DEA classification, so there's a special registration that's required, and the National Institute on Drug Abuse has to approve the research. There's some money being involved and being spent on it, so it's not like they're not doing it, but it's been limited, and they're limiting how and the type of cannabis that can be utilized, and most of it comes from the University of Mississippi. There's a bunch of other people that have applied to provide the cannabis for medical research, but the DEA, FDA, and the NIDA have not approved any other sites to this date. There are 4 products that have been approved by the FDA. You can see them up here. The cannabidiol, it's a pure CBD. They usually use it for seizures in children. Marinol and Syndros are synthetic drobanol, which is a THC, and people use that in and nausea, vomiting associated with chemotherapy, as well as and people, there's a wasting and lack of eating in people with HIV. Nalbion is this, it's similar to THC, and then that's also been approved for nausea, vomiting related to chemotherapy. Now, since these been approved, there's been a whole array of new medications that are much better for nausea and vomiting, and they don't have the side effects of some of these medications, but we'll get to that a little bit later. The plant has over 480 chemicals. It's got 65 cannabinoids. Most of it is protein bound. I won't go through much of the details, but how you inhale it or um, utilize it is important. Like the smoking, vaporization. There's some other approaches as well, but most of the people either smoke it or take it orally, such as tinctures, or sublingual, which is just drops under the tongue or inside the cheek, which causes increased absorption. The intravenous formulations are only for research purposes. The effects of the THC on the brain is mediated through these receptors called CB1 and CB2. CB1 are mostly the receptors that are localized throughout the brain. CB2 is mostly in the peripheral tissue and part of the immune system. The important aspect of this is that it's the location of the CB1 receptors that has the effects that people observe, and also the side effects that people observe. So I've listed a bunch of parts of the brain that there's a high concentration of CB1. So these become a little bit more important as we discuss specific side effects and actions that these receptors promote. You also have a series of what's called the endocannabinoids, and these are your own endogenous materials that actually mimic the THC properties at the CB1 receptors. So here's some of the central effects. There's disruption of the psychomotor behavior. So there's an issue with balance and fine motor. This is when people feel intoxicated and they have a difficulty driving. There is short-term memory issues. And then I put some locations of the CB1 receptors that affects these. Drowsiness, visual and auditory perception. There's anecdotal reports of people actually having these hallucinations, but they've been very difficult to reproduce in studies. There is stimulation of the appetite. They've noticed that people actually crave sweet foods more than any other type when they've done in some of the studies. Pain is a very important aspect of this. There's CB1 receptors throughout the pain pathways, and it's been documented that neuropathic pain works. It's treated very well with THC products. Chronic inflammatory pain, there's also some evidence of anti-inflammatory properties. There's not as much evidence for acute pain, and also there's a lot of side effects with the acute pain treatment with cannabis, so people are not recommending that at the moment. It works actually quite well with opiates, and potentially able to cut down on your opiate usage while you take the THC at the same time. There's been studies that have shown that people that are on opiates, when they start using cannabis, their opiate intake actually decreases. It's a very good antiemetic. It does have some side effects as well, but it's been widely used. And then we also talked about the two medications that have been FDA approved for chemotherapy-related nausea and vomiting. The intoxication or the acute effects of the THC, when people talk about feeling high, is a very complex experience. Typically, starts with a tingling sensation in the head or in the body, followed by some dizziness and lightheadedness. People feel like there's a quickening of their mental associations. It's a little bit difficult for people to focus. They go from one idea to another. It can also cause drowsiness and sleep as well. Two other aspects that are important is that development of tolerance. This is typically seen in people that are repeating the use of the cannabis, and they've noticed that they will take actually a little bit more. It requires a little bit more to get them to quote unquote the level they were at before. There is some evidence that there is some dependence associated. There was a survey that conducted that showed that about 9% of the respondents qualified under the DSM-4, which is a classification of medically to categorize people as being dependent on the THC. So there's craving, decreased appetite, sleep disturbance, weight loss, and less common anger, aggression, increased irritability, and strange dreams. This typically happens with the withdrawal symptoms, but this does not happen to everyone. But this is what's been reported in certain patients. Okay, and so the biggest question that I've had when we were doing the survey to see what topic to talk about is cannabis, does it have neurotoxicity? Does it affect the brain in a negative way? So there are a lot of animal studies that showed there is some changes structurally to the brain after cannabis use, but unfortunately these changes have not been very consistent in the studies that have been done on humans. There's some studies that show there's some changes, and other studies show that there's not a significant amount of changes. There's not been a significant evidence of any permanent brain damage in the adult users. So the adolescents, that's a different topic that's going to be addressed a little bit later. So this portion I'm just talking about the adults. All these statements that I'm making, they're the data for the studies are listed at the bottom, and I'll be more than happy to provide you guys with this PowerPoint, because I know some people like to look up where the data comes from, because I always do. Again, so some evidence of modestly impaired ability to focus attention and filter out irrelevant information in ex-cannabis users. Other studies have failed to find any impairment in cognitive function. There's little evidence that cannabis impairs work performance or leads to this quote unquote amotivational syndrome, that people become lazy and don't want to do anything. Again, no convincing evidence for any neuropathological changes in the brains of cannabis users. Again, the data is very conflicting. There's parts that have some changes, and then there's studies that show there's no changes. So there's obviously more research that needs to be done, and more research in a greater number of patients. Some of these research studies have been, the subjects have been quite a few, and obviously the more numbers you have, the better the evidence is. There's also been some functional changes across the cognitive domains, basically meaning that patients acting differently compared to the people that are not using cannabis, but again, it has not been consistent in the way the functions of the brain have been documented. Again, more studies needs to be done, both neurotoxics and neuroprotective. Actually, some benefit of the cannabis on the brain have been difficult to prove. CBD, we will talk about a little bit. That has been actually shown in some studies to be somewhat helpful, especially if people take CBD with the THC, which can counter some of the negative effects of the THC. The adolescent brain. So this is a very important topic, because it's been in the news quite often, and a lot of people are concerned about younger generations, anywhere from 13 to 19-year-olds using cannabis, and what effect this will have on them in the future, especially their IQ scores and performance in school. So this portion of the of development is very important. A lot of brain intricacies, such as the pathways, the tracks, and also the prefrontal cortex development occurs at this time. The prefrontal cortex is associated with decision-making, impulse control, attention maintenance, planning, and working towards goals. So again, it's very important to to have some answers for parents and also and teenagers themselves regarding cannabis. Obviously, in state of Nevada and almost every state, cannabis is only for adult use, only for 21 and over. So we just want to make sure that people follow strict rules that have been established. The proper structural maturation of the fibers, again, occurs at this time. This is necessary for the fine motor skills, sensory function, and also cognition, basically how teenagers think and act. Environmental factors, whether it's cannabis or other substances, can alter how these parts of the brain get affected and as they mature. There's two parts to the brain, basically the white matter and gray matter, and there's been shown that there is a decrease in both of those sizes in when cannabis is consumed in teenagers. There has been poor performance on tests, but these tend to revert back to pre-cannabis use after abstinence. Again, it's difficult to ascertain whether reported group differences reflect pre-existing brain changes that lead to substance use, or it's actually the risk-taking behavior of these teenagers that has them take the cannabis. So again, so it's either chicken or the egg a little bit in this context. And there's a large study that's just been started with the National Institutes of Health that's going to help shed some light on this in the future. I think I have that in there as well. So cannabis, it's only second to alcohol. That's the most widely used intoxicant. Alcohol and cannabis have similar rates in teenagers. 25% of adolescents report being drunk in the past month in this study, and 23% report using marijuana in the past month. Quite often, the teenagers are actually using both cannabis and alcohol at the same time. So that makes the studies a little bit difficult because you have two toxins that are actually working simultaneously to cause some issues. Most of the research that I'm quoting, and it's out there, it's considered observational. So you actually you're following people through and seeing what's happening, and you're asking them questions about things that have happened in the past. So it's kind of hard to assess causation, meaning if there is a cause to what's happened. So again, this NIH study that I'm talking about, it's following 12,000 children. It started in 2018, and they were either 9 years old or 10 years old, and they're going to follow them for about 10 to 11 years until they're 20 years old. And this is going to be extensive study on their brain development and the mental health, and regarding many types of substances, including cannabis and alcohol. So this will be very informative when this is completed and have a very solid answer to how this is, how the effects of the brain occur. So CBD, the receptors for CBD are not well known. It does not bind to the CBD1 and CBD2 receptors. It does regulate certain types of neurotransmitters. It does block some of the effects of THC. So that's the possibility of one of the neuroprotective properties of it. Possibly, it's been approved for seizures, certain types of seizures in children, and the proposed treatment of some psychiatric disorders such as anxiety, substance use disorder, and autism spectrum disorder has been proposed. A lot of studies have been ongoing with this, but there's no clear-cut answer yet. So the jury's still out, so they're still doing some more research on it. But it seems to obviously have some benefits. So there is the anti-inflammatory properties of the CBD as well. People do discuss having some help with anxiety, and some of the more common side effects are diarrhea, somnolence, and loss of appetite with the CBD. While we're talking about this, I always wanted to bring up alcohol as well. Obviously, it's the most used drug out there. It's legal for people over 21, and it does have some detrimental effects on the brain as well, which is quite similar to what they're proposing for cannabis, or quite a bit worse because they have a lot more studies out there following adolescents as well as adults that have been on alcohol or have alcohol use disorder. It's always good to keep that in mind as well, that there's always other toxins out there that have a detrimental effect on the brain. So alcohol consumption during adolescence is associated with significant differences in the structure and function of the developing brain. Several factors increase the risk of alcohol use disorder in adulthood. It's if the teenagers start early, if there's binge drinking, and if there's a large amount of drinking per occasion, and this can lead to escalating volume of frequency of alcohol consumption in the adult. Now, psychiatric illness. Now, when there's some evidence out there that people when they feel high or intoxicated for acute use of THC, they have some similarities to a psychiatric disorder. This has been shown that it's reversible, but patients have presented to the emergency room and they've labeled it cannabis psychosis or marijuana psychosis. And this is typically due to a consumption of a large amount of cannabis. And people kind of present like a schizophrenic. They have delusions of control. They have grandiose identity, or they're being persecuted. They have thought insertion. They think someone is controlling them. They have hallucinations. Typically, they hear things, and they have a changed perception of how things are around them. So again, this is typically someone who has taken a large amount of cannabis, quite often is probably with edibles, and they have not waited, and then they have not felt anything, so they continue to take more edible, or someone that actually smoked too much. So again, it's typically self-limited, and it settles down after the THC has worn off. But it looks quite scary to the people and to the person that's feeling it, and also the people around them. And this is why sometimes they get taken to the hospital and to see what's going on. There is evidence that cannabis can exacerbate some symptoms of existing psychiatric illnesses, such as anxiety and underlying schizophrenia or any type of personality disorder. So it's not recommended in those patients. So the other topic that's important, pregnancy and cannabis. Cannabis is frequently used by pregnant women due to its anecdotal treatment for morning sickness and widespread acceptance as a harmless drug. Quite often, mothers don't know that breastfeeding mothers don't know that the THC can actually get transferred in their breast milk to the infant. It's very important to not have the pregnant women use cannabis during their pregnancy or while they're breastfeeding. There has been some evidence of so this portion, obviously, of the development is very critical. The endocannabinoid system, where we talked about the CB1 and CB2 receptors, are getting developed at this point, and having the THC can affect the development of these areas, and it's quite similar to the fetal alcohol syndrome, which I'll just briefly discuss in a bit. So again, it's very important to educate pregnant women that it's not without harm, and it's not the best treatment for morning sickness. So pregnancy and alcohol, it does impair the growth, stillbirth, and the fetal alcohol spectrum, which I've listed some of the behaviors that happens. So the incidence of alcohol use in women between 18 and 44 years old is 54%. And the incidence of pregnant women actually using cannabis is 10%. So we obviously want to keep those numbers much lower if it's possible. There is some drug-drug interaction, but I won't go into detail on this. There's, again, the different types of strains that we talked about, the that you see out there. Most of them typically tend to be hybrids between the sativa or the indica. Again, THC more of the psychoactive component. It acts at the CB1 receptors. CBD is the non-psychoactive component and can diminish some of the side effects from the THC. So as far as recommending, obviously it's not recommended for adolescents. It's not recommended for pregnant or breastfeeding women. For adult use, always start slow and always start with low dose and go slow. You can always take more later, especially with edibles. Give it 45 minutes, an hour, and then proceed from there. And most of the adverse reactions are seen in the new users because they're not used to it. Either they take too much and they have that cannabis psychosis that I discussed earlier. Again, it's mostly reversible and it's very short-lived, about 3 to 4 hours. So hopefully people around them will just calm them down and allow them to just get through it. So what the future holds is this NIH adolescent brain cognitive development study. This will give us a lot of information regarding the effects of THC on the adolescent brain. And for adult use, we need more of basically what's called a longitudinal study. We follow these patients for many years to see what happens with their consumptions of THC and how their brain changes over a period of time. Again, a lot of research is being done, and if you just follow those simple suggestions, I think we'll be in good shape and continue to reap some of the benefits of THC, which is it's been reported in a lot of patients. Again, not for everyone. In my clinic, I always tell the patients, let's try cannabis if you've not tried it before, and if it can get you to cut down your opiates, or if you can get off your opiates, why not? It's much better that way. So that's my talk. Now I know there's some questions, so I will get to them at the moment. Again, thank you for everyone taking time from their evening and spending it with us. And again, thank you for Sanctuary for sponsoring this. So one of the questions, can you replace opiates with cannabis? If yes, at what level opiate use? So I think they meet, can you, so again, everyone's a little bit different. I think it's important to have a discussions with your physician or whoever prescribing the opiates. There is again, as I said earlier, I do recommend alternative therapies for my patients in pain. That includes like such as acupuncture, different types of medications, and also cannabis as well. So again, they've tried many different things. I tell them cannabis is another option out there. It also depends on their type of pain that they have, and the type of strain and cannabis that I would recommend is also dependent on when they need the pain relief. Is it during the day? So I kind of recommend something that's more of a sativa based versus an indica, because obviously, as we all know, that the indicas do make people a little bit sleepy. So we don't want them to take it during the day while they're working or going to school or doing any other activity. So indica has a very good profile for helping people with sleep at night, and in some patients reducing anxiety. Let's see what else we got. One question is like, what is the safe dose of cannabis use? Again, so this is a very individual based. Again, you get start with a low dose. You can always take more if you need it, and go slow. Give it some time. The ultimate goal is not to get high; is also to alleviate the symptoms you're taking it for, especially in medicine, obviously. I hope that answers that question. Let me see if there's anyone who has any other questions. Okay. Well, I'll try to make these not longer than 30 minutes, because I know people's time is valuable, and people's attention span is usually not more than 30 minutes or so. If anyone is interested in getting a copy of this PowerPoint, I don't have a problem. Just shoot me your email and I will email it to you, and I'll see if we can have it actually available on the Sanctuary website under education, and that way you guys can view it there or download it there. And if that's not possible, we'll definitely have it emailed to you. I'm gonna type my email, and I think it should show up there. So if you guys let me know if my email shows up, and you guys can email me. And for some reason, if there's some questions later on, I'll be more than happy to answer any questions. Okay, it says you don't see it. So let me see what I can do. So can you guys see it or not see it? Okay, perfect. Okay. All right, you guys, thank you again for joining me for this talk. I hope everyone has a very good evening, and I will just shoot me an email and I will send you guys the PowerPoint, and hopefully it'll be on the Sanctuary website as well. Have a good evening. Thank you.